Right. Good morning, everyone. Thank you for logging in good time and a very good Monday morning. And this is our mid-term review so that we touch base on what is going on so far. And then it helps us to also get ready with the remaining quarter, more like a quarter left in the year. And we look at the status. Where are you at? What are some of the things that you need to improve on before we proceed on? So I would want to, before we start, I would want to invite Teresa Mwangi to start us off with a word of prayer. Teresa? Can you allow Teresa to talk?
Can you hear me now?
Yes, go ahead.
Okay, thank you. Let us pray. Our Heavenly Father, we come before you this morning. We thank you for the gift of life. We thank you for having been with us as we implement the ADA indicator. Jehovah Lord, we pray that as we deliberate this morning, we pray that you may be with us. Help us to monitor our progress, our successes and challenges, that we may be able to discuss and have a way forward. Jehovah Lord, we thank you for all the institutions represented in here. We pray that Jehovah Lord, you may be with us as we start this meeting and as we end. For it is in Jesus' name that we pray and believe. Amen.
Amen. Thank you. All right, so just a few rules. If you need to speak, then you will raise your hand. I can already see 4 raised hands. I don't know if it is by default or they already have something to say, but at this moment we will not allow people to speak. We will start with the presentations first. Also, there is the Q&A, so you can ask questions, you can make comments there, and you can also use the chat. So those are the tools that we are going to use during this session. You can use the chat. As I can see, so many have already said good morning, good morning, good morning, and good morning, everyone. So the other thing that we shall do is, like I said, the Q&A, so that if you have any questions, then they will be responded to as we go along. As you can see on the screen, that is our agenda. We are going to keep it short. If we can finish early, the better. So we are going to have our opening remarks. Then we will give you those status as things are. It is going to be general, but again, you will reflect on what you have from your own institution. And you can see we are going to have a question and answer session, and that is where people will be able to raise up their hands and if you have any questions, then you can ask at that point and you will get answers. So also logged in are our regional officers for tertiary institutions. You know that the regional officers have been reaching out to you. They are also here and they will be able to answer questions if you have any. We also have the research department. So for those who may have questions on the research, then that will also be done at the question and answer session. And you can see on the agenda, we also have demonstration on the reporting tools. Just in case you have challenges with the reporting tools, then again, we will be able to do in this session. And also remember that beyond this session, we are always ready to support you, whether it is via phone call or any other means that is available. So at this point, I would want to invite our director in charge of public education and advocacy and rehabilitation, Dr. Yvonne Orlando.
Thank you, Susan. Good morning, everyone. Good morning, colleagues. And it is good to be part of this team this morning, and I'm very happy with the turnout. It's a few minutes and I'm seeing we are almost half the number we're expecting, so I know it will be a very productive meeting. Mine is to say karibuni sana. We have been communicating with most of you. We have been trying to resolve some of the issues raised, and we are here to look at it, if I may use, as a family. You know, we are all in the same government, just to see where are the challenges? What are the challenges you're facing? Where are you at? So for the ones that we've been able to train, every training, we actually tell you the documents you've received, where you have not maybe done it the correct way, and you're able to guide you. So if you're still not clear, this is the opportunity for you to ask and for us to clarify. For the ones who reached out because maybe you're having challenges, we've been able to try to address this. Again, this is a very good opportunity for us to clarify it further. For the ones who are having challenges with either being in level 1 and level 2 and graduating yourself automatically, and then you're telling you, no, that is not the case, this is also an opportunity to clarify. This particular meeting is just to help you know where you're at, address the challenges that you're having, and also to guide and also to get from your feedback on where or what we can be able to do better. We want to support each other so that this particular PC target is achieved to the maximum. We do not want people failing. We actually want, if possible, everybody to get 80 and above. So karibuni sana, feel very welcome and be open with your questionings and with your feedback. Thank you. Over to you, Susan.
Thank you, Director. And with me, we also have Diana, who will be managing the chat, and will be able to demonstrate to you some of the tools that you require. All right, so why are we having this indicator? We want to reduce the prevalence of ADA in the public sector. And where there is already a problem, we want to mitigate on the negative effects. And this is a specific focus on the public sector. That does not mean that we are only focusing on the public sector. We also have other settings. The workplace is just one of the settings. We also have the informal settings, workplace settings, and we reach them through what we call out of school youth. We also have other programs that are targeting the school setting, media, and the community, and even family. So do not worry why only one area. So what is the roadmap with regard to addressing this indicator? And you can see that the first thing that you need to do is to actually build a team. And that team is the committee. It is driven, the work is driven by the committee. And this committee needs to be established, and most institutions have already established this committee. These committee members need to be trained on workplace-based prevention interventions. And those who have undergone training, you know that it clarifies nearly everything that you need to know about the indicator. And it covers all the components that you need to cover, including review of the policy within the training setup. Now, the other thing, once you have built a team, the next thing that is important is to assess your workplace. And that is where we have the baseline survey. So for the baseline survey, you want to understand the situation within your institution. It's not a one size fits all. And that is why you need to have that assessment so that you identify the risk factors and what is the cost of substance use in your own institution. The next thing that you need to do is to actually develop a policy, and you're going to find that your policy, for those we have already engaged with, you'll find that your policy is not going to be complete without the survey, right? So in development of the survey, you need to involve the stakeholders to develop it. And the approach is not punitive. It is supposed to be a health and a safety standpoint, so that the committee may drive the agenda of developing the policy, but you must include all the stakeholders. So it means it must have the input of staff, and where you have students, it needs to have the input of students, even if it is just as student leaders. And then you can see, for you to actually take off, you need to implement your plan. And the plan is addressing the situation in your institution and the risk factors. And there is where you're going to have even preventive education for staff and even training for supervisors. So that is with regard to prevention. But on support, you also need to provide support for those who already have substance use disorders or those who are already experiencing problems. So that means that you need to put in place mechanism to support employees with substance use disorders and other challenges. And that is where the EAP comes in, the Employee Assistance Program. And lastly, you need to monitor and evaluate. And so you know that here, what did you intend to do? How are you doing it? And you need to also submit your reports in a timely manner. And we shall talk about that shortly. So these are the PC activities when we look at level 1. And I want to say at this point that I know there were challenges with people who say, why are we still in level 1? How do I explain to management that we are still in level 1? You see, level 1 is a starting point, and it doesn't mean that if you're still in level 1, it is because you have failed, right? And it also depends on what you have achieved so far. So in level 1, you should have submitted your work plan by 30th of September to be able to get your 10%. So if you haven't, you already know you are minus the 10. You're supposed to conduct your baseline survey. The other thing is to establish or operationalize the committee and also train the members. The other is to develop and implement the workplace policy. You need to sensitize staff at least twice, and also establish support mechanisms for employees with substance use disorders and submit quarterly reports with evidence. So what does this mean? If you are to undertake the baseline survey, and a number of institutions have done that, you don't just do the survey, but it has to be disseminated. It has to get back to the people who also participated. So you can see it includes anonymous survey of employees and students, and the tools for data collection or the questionnaires are available on our website, both the ones targeting employees and also the ones for students. The other thing that you can do in your survey is also review workplace data, whether it's absenteeism, healthcare utilization, disciplinary actions, because those then inform the kind of situation you have. What is the cost of ADA at the workplace? And those who have been in training, you know what we mean by that. And then review of the current workplace policies and practices where that is applicable. So once you have conducted the survey, the other thing that you need to do is to disseminate. So some of you in the last financial year may have conducted the survey but did not disseminate. So it means that if you carried forward that target, then it means that the only portion that is left for you is dissemination. And we are also indicating, because there are institutions that continue to implement the ADA indicator even when it was removed from the PC. And so they may have had surveys done. If they were less than 5 years, then they only required a follow-up survey. So when it comes to establishment and training of the committee should have at least 6 to 12 members, which should be drawn from all the levels of your institution, with at least 50% membership drawn from middle and upper level management. And one of the people who must be members of that committee is the human resource manager, or the designated person responsible for human resources. And that is because these people have a better idea of the Employee Act and employee relationships. You require somebody in charge of occupational health and safety. If you have that representative, it must be a member of the committee. The employee assistance and wellness representatives also must be members of the committee. And where you have trade union, they need to also be represented within the policy, within the committee. And these committee members need to be in office for at least 3 years. And this is why we have had cases where you train people. If there is a training, you find a group of people have come, they are the committee members. When it comes to reporting, you see a new name. And then they say, I don't even know who sent. Can you share with us a copy of our work plan? We don't know who is supposed to be doing this. And then you find that somebody is trained, and before they even implement the next thing, they are not there. So that is why it's important that at least 3 years, so that you are able to put structures in place. For committees, you can see you are going to train the committee on workplace-based prevention interventions, which happens in various forms. We have the clustered, which is usually scheduled. We have in-house, and we have online. For institutions who already trained their committees in the last financial year, you realize that you did not need to train the committees, but instead you need to have quarterly meetings so that you even review your progress, you decide on what needs to be done, look at the evidence before it is sent, so that again, you are on the same page with regard to that. So on development and implementation of this policy is the evidence. So that is why we put a lot of emphasis. Once you get the policy right, in the subsequent years, all you'll be doing is implementation. So if you have already done baseline survey, you'll find that you're going to drop it. If you have already developed the policy and we have given you the go ahead and say it is okay, thereafter, all you're doing is implementation. So those are the two targets that you drop: development and also the baseline survey. So this policy is not a one size fits all. I know people have been asking, oh, so can we get, can we just have one so that as we just do the implementation? The institutions are very different. They are very diverse with regard to location and the challenges that you are dealing with. So the guidelines are available on our website. It has been made very simple. It gives you the outline that just shows forward. This is what you put in the forward. Number one, introduction. This is what you have in introduction. Number two, situation analysis. And that is why you see that the policy is informed by the findings of the baseline survey. So you need to have it. So number 2 then talks of the situation. Number 3 is a policy statement. So everything has been outlined for you and what you need to put under it so that it makes it easy for you. And again, we've seen situations where some people have put too much information that is not required. So when we say, please just delete here, just delete, because it's supposed to be simple for use by everyone else within your institution. Now, the other is sensitization for staff and students. Students in case of educational and training institutions. And you can use various methods. You can do lectures, you can do seminars, you can do workshops, and that can be done virtually, yeah, with the adaptation to technology. It has become very easy. And sometimes even when you request that we be part of your sensitization, we say, please just send a link, because we don't need to travel to your institution. And you can see, you can also develop your own IEC materials. The purpose is to increase staff and student population awareness on prevention for themselves and also their families. So you need to conduct at least 2 sensitizations. And the topics to be covered, you can see have been shown there. And of course, it is also informed by your institution survey. So these are generally what would cover, or you would find across many institutions. But from your survey, you may find there is need to address financial management, for example, because it becomes a stressor. It may be having to do with mental health and addiction and so on, as shown there. So again, it depends on what you have in your survey. All right, so the other one is for those who are already experiencing substance use disorders. You need to establish the support mechanisms. And so if you have established, then it needs to be working. It's not where you just pick a box and say, now we have it. So operationalize the EAP for both staff and students. What this means is that if it is an institution, for example, you have health services, that is where students are being reached. What kind of services are available? So you provide a schedule of the services that are available. If, for example, you are using only NHIF, what kind of services is available? If you have other service providers, you know, private service providers like Jubilee or UAP and so on, what is the schedule of services that are provided? It includes counseling, it includes psychiatric, yeah, you know, psychiatric services, all that is part of the assistance program. And now we have an EAP reporting form, which is also provided on the website. And the reason why we came up with this is some people are sharing personal information. You are saying we are going to keep it confidential, and then you send us details that are not necessary. So to protect confidentiality, we change so that it becomes easy to protect that. So this is the marking scheme. Yeah, this is a marking scheme. This is what we will be looking for as you submit your evidence. So if you have already provided your work plan, you know that it needs to be sent to us. First of all, it is better to send a draft. We look at it. If it is okay, then we give you the go ahead, and then that is when you can file it. That is to reduce once you have filed it upfront, and then we say you need to edit. But even if you had submitted, we'd say, please edit. You need to allocate resources for implementation. So what will we be looking for? A costed annual work plan to show now if it is staff training, how much have you allocated? Even if you have allocated 0, you say you have allocated 0 because training will be online, since online is free. Baseline survey, if it is baseline survey, how much money have you allocated for that? Even if you're going to do it internally, yeah, what are the costs? What are the costs? And so basically you need to provide a costed work plan. I hope that makes, and it is what you attach as evidence. So that is what we'll be looking at. If you are undertaking the baseline survey, you need to give the letter of engagement for the survey, because it is done in 3 ways. You have the option of 3 ways. One, you could engage with NACADA, and therefore there will be some kind of communication that shows that NACADA is doing it for you. Option 2, you could be doing internally, because even as tertiary institutions, you have capacity as those who are already doing researches. You're actually the bedrock, or should be the bedrock of research. So it means you could be doing it internally. So there's got to be some kind of communication that is, whether it is a memo that goes to staff to show that the survey is going to be done between this period and the other. Option 3, you could engage a consultant, a private consultant, and therefore there has to be a letter of engagement. So I hope that is clear in terms of what is required. So what else will we be looking for? The report of your survey, not a screenshot of the outer cover, the whole report, because this is what you will be implementing. The other thing is, after you have done the survey, you also need to disseminate. That's why I was saying, if in the previous year you had done the survey but you had not disseminated, then in this year you are doing dissemination. So dissemination report, and you can see it has registration lists, the number of people who are sensitized on the findings, and even students, depending on your own institution. So you require a report and registration list. Don't just send registration list, because if you send registration list, you will only get half a mark, half of the marks that you should actually get. So that is the marking scheme for that. Now, in the next one, where you have the committees, if you have established or reconstituted, there needs to be copies of letters of appointment. So whether they are loose letters or it is one letter that lists the people who are part of the committee, that is what forms your evidence. When you hold meetings, because you are supposed to be holding meetings, minutes of meetings held quarterly, and they need to be signed minutes, not something that you are going to work on 30th June, and then you submit, and clearly it shows that there is no authenticity in the report, in the minutes. So please, quarterly meetings held, and you submit when they have been signed. For training, if you have been trained, you require certificates. So how many members have been trained? You need to have trained at least 3/4 of your committees. So those who are sending 1 person, 2 people, you can imagine how long it is going to be in your work plan, training committee. So because we have online, where you can even train all your members at the same time, take the easiest route. So we want to see how many members have been trained, because we are going to look at the letters of appointment vis-a-vis the ones who have been trained. So how many members have been trained, and then the copies of those certificates. Don't just say because the training is being done by NACADA, NACADA knows who has been trained. When it comes to evidence, please provide the certificates. So if you complete the training, you get certificate. All right, so those who do not complete the training, you also know you don't get a certificate. Okay, when it comes to the policy, what will we be looking for? A copy of your policy. So if at the end of the year, you shall have concluded it, then you are going to submit. If it is not concluded, you will also send what is there. But please don't send one of 2014, if you are sending us a policy of 2014, it is very clear that you have a lot of things have changed since then. Yeah, even the structure of that policy has changed. So because as a committee, you will be also looking at, for you to eventually even have the policy, you must be having minutes of review meetings held. And this is what happens in some institutions when they come for the in-person training. While they are there, and because the review of the policy, development and review of the policy is done during the training, they also take advantage and have a meeting. So you see, they shall have killed two birds with one stone. You have the minutes, you have a meeting, you have the minutes, and you also have worked on your policy. So that is what we will be looking for in the case of the policy. So for sensitization of staff, remember I said at least 2. So how many sensitization forums will you have done? And then you submit the report and registration lists. Tafadhali, don't just send lists. And sometimes they are lists with no titles. So you can't even tell what it is about. The other on the establishment of support mechanisms for employees with substance use disorders. I already explained on the schedule of EAP services available or offered. So, and this is where the human resource also comes in handy, because they are the ones who probably deal with issues of providing these services. And some of the service providers also do sensitizations. They sensitize staff on the EAP services, or you could even organize with your service provider to sensitize your employees. And so you can see part of evidence we'll be looking for is sensitization forums on the EAP services. If people don't know about the services, they will not undertake. They will not even access it because they don't know it exists. So you provide the schedule of the services. There is a fillable form on our website, and Diana is going to just show us as we come to the end how many students or staff have been referred, whether it is for counseling and treatment. So what kind of services have been offered? And like I'm saying, please, you need to have a forum where you sensitize staff and possibly even students on the services that are available. Now, when it comes to submitting of quarterly reports, you know that by 15th of the month after the end of the quarter, you are supposed to submit progress reports in the prescribed format. This is also a fillable form, which is found on our website. So you will be able to fill it. Now, sometimes people take an old one and then you say, oh, you know, this, I cannot be able to fill this one. The reason why you will not be able to fill it is because it's an old one. That is, if it is for the last financial year, it's already closed. So every time you submit your quarterly report, use the form which is available on the website. You need to attach evidence to the online report. So there is, you should be able to attach evidence. And that means that before you start filling in your quarterly report, you should also have your evidence, all your evidence, and correctly labeled. There are people who just use the scan. It is written CAM scammer, and that is what is attached. Please label your evidence correctly so that if it is EAP schedule, label it at EAP schedule. If it is meetings, label it as EAP or meetings, minutes of meeting for this quarter. So it's very important that you label your evidence so that it does not get lost. And sometimes when you're using like Gmail or Yahoo and you have not even, it's not labeled correctly, we cannot even tell which institution you are from. At least those ones who have the emails from institutions, you can guess which institution it is. But if you're just using Yahoo or Gmail, it's not possible. So please label your evidence correctly. What we found out is sometimes we have committees that are handling both HIV and even ADA. And then you send the minutes. And in the minutes, you did not even mention a single word on ADA. So what you have sent us is on HIV. And we read the reports, we look at the minutes and so on. So on the one hand, you think you have submitted, in actual sense, you will get a 0, because if you sent the minutes and they are on HIV, then we think you missed out. Instead of sending to NAC, you sent to NACADA. All right, let's talk about progress to level 2. So you can see in level 1, for those who are starting, that is what you're supposed to do. For you to pick up some of the activities in level 2, it is because you have established and reconstituted and also trained your committee members. At least 3/4 needs to be trained for you to pick an activity in level 2. You shall have also undertaken your baseline survey and disseminated the findings. And so you have provided the report. You should have also developed your area prevention and management policy. So if you have already done those are the things that you are going to drop from level 1. So just because you're still doing activities in level 1 does not mean that you have failed. That I mean you have failed. You have simply selected from level 1 and level 2. That is what it means. So please do not put yourself. There are people who decided to Memaliza level 1, we are in level 2. Meanwhile, we don't even have a single report, as you are saying that. Okay. So what do you expect to see in the one for the PC activities if you are going to be in level 2? I don't know why there is a delay in. There's a delay in progressing. Okay, so I can see my screen is still showing progress to level 2, and I'm supposed to be looking at level 2. Oh yeah, all right, so there it is. So in level 2, you can see in level 2, you still need to submit a work plan by 30th of September. Now you can see the new activity in level 2 is to train supervisors and managers on workplace-based prevention interventions. But for tertiary institutions, you are supposed to train student welfare staff. So it's either of the two, not both. So there are those who are doing managers and supervisors, and there are those who are training the student welfare. So if you already developed the policy, you can see in level 2, you are implementing the policy, right? You are implementing the policy. Then there is sensitize staff and families on positive parenting. So that is a level 2 activity. So that gives you 20%, and then strengthen social support through peer and informal referral. That is also a level 2 activity. And then you have submit quarterly reports and evidence. So again, there could be variations in terms of percentages depending on what you did not complete in level 1, even as you pick level 2. So I hope it is clear so that we don't feel like, oh, you know, why am I still in level 1? It is about selection of activities, not movement from one to the other, so that it looks like you're still in Form 1 instead of going to Form 2. All right, so the one for work plan, that is clear. I'll talk about the training of managers and supervisors on workplace-based prevention. You know that managers play a big role Now, why am I now having? All right, it just dropped. All right, sorry, it dropped. So I was talking about managers and supervisors, and for managers and supervisors, these are done by those who have completed the 3 criteria. So there are those who may have selected training of managers and supervisors, and yet you went and kept quiet. And then suddenly you realize Q3 is ending, you have not completely trained your members from committee members, you've not completed, and you have also not finalized on your policy, and then now you're rushing. So for tertiary institutions, I know some of you have already even done that training. So that is good enough for you. For positive parenting, skills education on alcohol and drug use, prevention and wellness, preventive education for staff and their family members. So this you could engage with us. And when I say us, it means we have regional officers who will be able to support you on that. And for headquarters, we also support those who may consult with us. But remember, you can also engage anyone else who will be able to give you the parenting skills education. On our website, you will also be able to find a booklet that we have developed on prevention, conversations that parents need to have with their children. As you may already be aware, that when it comes to prevention of substance use, even amongst your children, it starts with you. And so if you don't have the right skills, you could be waiting for schools to do that, and they will not do it for you. All right. The next one is on strengthening social supports through peer and informal referral. And those who are doing this know that there is the aspect of the peer educators. Those who have reached that level are doing peer education training. So that is available only when you have reached there, because through training, then you will know that we have 3 forms of referral. There is self-referral, there is informal referral, and then there is supervisor referral. So that is why each of these groups are targeted. And then you need to implement the policy. So implementation of policy is something that will run across your indicators year in, year out, because either you are developing or implementing, so that you address the issues of whole workplace. And whole workplace means the ones who are not using, the ones who are at risk, and the ones who are dependent. So implementation, the target is not just the ones who have a substance use disorder, but the whole workplace. So if you're in level 2, what will we be looking for? This is the marking scheme available well in advance. So you can even tick and see how much you're going to score at the end of the year. So if you are training managers and supervisors, and so far only 8 institutions have done that, how many have you trained? If it is student welfare, how many have you trained? And then the copy of certificates. You will attach the copies of certificates. If it is parenting skills education, you can see it's a sensitization. So what you need to submit is a sensitization report plus the registration of those who attended. And remember, registration you can get even for virtual attendance. You saw that you registered to be able to come here. And again, we are also going to have evidence of live attendance. So it's not just registration, but also evidence of live attendance. So it means that even if it is done virtually, you will still be able to get evidence of your registration. So for social support, you can see it is training for peer educators and then sensitizations. So it means that if you're not able to do training for peer educators, then there is sensitizations. And when you do sensitizations, we require registration lists of those who participated. In the next one, which is implementation of the policy, remember, you can see there is the EAP services, there is the fillable form on the website, and then there is sensitization, because that is part of implementation of the policy. Then we come to submission again. As it applies, progress reports should be submitted by the 15th. Like now, we expect that by 15th of April, you should have submitted your report and also evidence for this quarter. So if you have not submitted, what are you going to do? Yeah, I can see somebody saying, explain more on evidence of virtual attendance. This is virtual attendance. First of all, we sent you a link, and then you'll find you need to register. Once you have registered, then you are going to have live attendance. And even if you use Zoom, you can do recording. And you know that these days it tells you recording has started, and then you say got it. So it means that when you say got it, you will get actually a recording. Okay, so that is provided for. So even if you do virtual, you will be able to get your registration. And then also remember that the chat, like now I can see there are quite a number of things that are coming on the chat. That is also going to show that there was actually sensitization. You also need to take screenshots. When it comes to attendance, you also take screenshots, because in an in-person, you will take photos. In virtual attendance, you also have screenshots. And on your laptop, you'll be able to, if you don't know where that is, PRTSC is actually the one for screenshots. Find out where it is and get the screenshots as evidence of what you have done. All right, now when it comes to monitoring, so now we are done with the part of whether you are in level 1 and 2, and please put it in your head that it doesn't mean that you need to move yourself. It's about activities you pick, okay? It's activities you pick, not what is there, okay? So in terms of monitoring and evaluation, you needed to have submitted your work plan by 30th of September. If you are late, you are already minus 10 points. And even if you are minus 10 points, please submit your work plan, because thereafter we will look at what you are implementing. What you are implementing is what is in your work plan, not where you just wake up and start doing many things in between, because sometimes you will find you end up with evidence which is not required. You can see I've already shown you, this is the marking scheme. This is what we are going to look at, and it is straightforward. Please don't collect many other things. It's not the quantity of what you send, but the quality of what you have sent. Again, submission of quarterly reports is part of monitoring. And so please do so within 15 days following the end of the quarter. All submissions are done online, and you can access these via our website. Yeah, via our website, you will be able to get that. Quarterly evidence needs to be attached to the online report. However, if you have forgotten, one, you can go and edit. Secondly, you can actually now send the evidence to workplace@nakada.go.ke, and we are going to create a folder. We create folders so that all your evidence goes there, but it must be labeled correctly. Tafadhali, label your evidence correctly, because we have seen some things. Sometimes you read and you wonder, okay, so what exactly was this? Or sometimes you label and what is inside is different. Okay, so please do that. So now, what is the status? Having said that, what is the status? We expect work plans from 450 institutions, and you can see 379 have submitted. Even if you show up today, we will just begin from that point where we work with you so that you have your work plan submitted, even though you will not get marks, for it, but from there on, you can implement that work plan so that even in the subsequent year, you know what is expected. In terms of Q1 and 2, online reports, that is the quarterly reports, you can see even out of 379 who have submitted work plans, 327 only have submitted their Q1 and Q2 report. That is the Google form. And I would like to say that if you submit a work plan, you get a copy right away on the email that you used. So if you use the email ceo@nakada.go.ke, when you finish filling, it will go to the CEO. And so if you send it to the CEO, then it means that you will have to ask your CEO to give you the copy of the work plan. If it is quarterly reports, when you submit, at the top there is an email, and that email, if you are the reporting person, it is that email that you write, because once you finish, you automatically get a report. So please don't start calling, writing. Also, can you please send us acknowledgement? It has already been acknowledged automatically, because from our end, we will have to look at that vis-a-vis the evidence. And as you can see, in Q1 and 2, 327 have submitted their reports. When it comes to evidence, only 177 have submitted Q1 and Q2 evidence. So you see that also brings a delay. So don't just press send, and after sending, you are calling. If not calling, then sending email reminders. Please acknowledge if you submit online, and it is a Google form. If you are submit online, you automatically. I'm repeating this so that those who usually send, please acknowledge. It has already been acknowledged, so that if you need to take it to your management, use that as what you take to management. So you can gauge yourself. Another thing that we've seen this quarter, it is so and so who has filed the report. That is what, remember, it's the email you use that it goes to. So if it is CEO, MD, it goes to the MD, including your invitation to this particular forum. If the email you had put there is for your MD or the CEO, that is where the invitation went to. Okay, so gauge yourself. And sometimes if we have not received your evidence, we write back and say, please submit your evidence. And then you don't hear anything from that person. So just submitting the online report with no evidence does not count. So what is the status with regard to training? You know, as a committee, you needed to have been trained at least by Q1 or Q2, at worst Q3. But if you haven't, then what are you implementing? Because clarification is made at the point of training. So you can see in this financial year, 106 institutions have been trained. Most of them are online trainings. Yeah, most of them have been trained online. Number 2, for tertiary institutions and universities, you can see 67 institutions have been trained. Again, the bulk of them being online. Student welfare, we also have a number of institutions who signed up for this and they have been trained. Almost all of this training is online. For workplace-based prevention interventions, meaning these are people who picked level 2 activities. And there were 46 institutions, only 8 have trained so far. So you can gauge yourself if you intended to do it in Q3, and this is what has been happening. Somebody realizes, oh, we are supposed to do it in Q3. Then they write to you today to train them next week. It doesn't happen like that. So there has to be lead time, and we schedule according to who comes first, and especially if you have already made the payments. So we don't begin by giving you a date. It's the other way around. You fill a training booking form, you commit whether it is an LSO or you have made payments, and then now we can schedule the date. Okay, so the only one that does not have online training is managers and supervisors, and you can guess why we do not have that as an online. All right, so what are some of the gaps? I can see there's a delay again in the screen. All right, gaps identified. So these are the gaps that we have identified on the work plan. Number one, we've dropped. Okay, so technology is also working against me. So what are some of the things, what are some of the gaps that we have identified? And please, as you do that, I hope now, George, you can hear me. He was saying I am muted. So one of the things that you know that you must do is to consult with NACADA on your work plan before you sign with respective performance contracts. But you find there are people who decide, sisi tumetoka level 1, tuko level 2, you don't consult with NACADA, and then you end up with the wrong activities, because we have also specified how the activities, in fact, we give you and say, it needs to be looked like this. This one is okay, please amend this. And sometimes you say, you have selected the wrong activities, please amend. You don't hear anything from some people. So that's why you see non-compliance with the submitted work plan. So on the one hand, you have the wrong activities. We tell you, please change. You see, even if you've submitted by 30th of September, it means that you have already got your marks, but please, you require to amend. If you require to amend, please amend the work plan. And sometimes somebody disappears completely. You don't hear about them anymore until Q4, when they say, please share with us the work plan. So what have you been implementing if you don't even have your work plan? The other is non-compliance with the submitted. Now you have submitted a work plan, and indeed you have said, this is what I'm going to do. But in the process, you haven't. Yeah, you submit it and then you go ahead and do other things. So please also adhere to the work plan. Now, in terms of implementation, remember we said the training of the committee members should be done by NACADA. One, because this is a new approach. It's a new approach. So we have not had another body out there that is also training on the same thing. So that is why we say when it comes to the training of the committee, it is being done by NACADA. When it comes to sensitizations, then you can involve anyone else who is an expert, whether it is financial management or stress management and so on, conflict resolution. if that is the issue at your workplace, you can engage. But the training of the committee is only done by NACADA. In terms of implementation, we have also seen non-conformity of the policy with the guidelines provided. Tafadhali, use the guidelines as they are provided. They've been made very simple. I say this is the outline. But even those who have been in training, even those on online, you say you have 3 weeks. If you are in the online training, you know that in lesson 6, we actually, you present your policy and we give you feedback. And after that, you send us the policy so that we look at it within the context of 3 weeks as part of the online training. And then we give you feedback. And sometimes I have made the feedback, it is in track changes, and you don't hear from those people again. Yeah. Then they send one which is not conforming. So it means that the training did not help, or even the time spent in it also is lost. All right. The other gap has to do with reporting, and some of them are already mentioned. Submission of online report with no evidence. Remember, that only gives you probably a quarter of the marks. There is the part of evidence. So when you submit the online report, that you have just managed to beat the deadline, because some people are going to wait until 15th night, and sometimes they have challenges. So they want to call you in the night and say, I cannot find. And yet they are using the wrong form, which they should have done in the day, but in the night, in order to beat the deadline, then that is the time that they want to make their stress become yours. Submission of unnecessary documents. We have already indicated what will be the marking scheme. You know in advance what we will be looking for. There is no point of sending us documents which we do not require. Please do not send us the training booking form. Don't send us the training booking form. Do not send us the communication that we've had back and forth because of the training. That is not evidence. When it comes to training, we've already said it is the number of people trained, which we can see by the copy of certificates that you have submitted. So please don't send what is not necessary, because it may look like you have put in a lot of things when most of them is just going to go to the dustbin. Well, I don't delete it, but basically it means that it will not count. So another thing, submission of pictures, registration lists, posters, flyers, brochures, PowerPoint presentations, and screenshots of PowerPoint presentation, etc. without the report. Those really do not count. So please do not send us that. I can see some people are saying, oh, please share. This is very informative. Please share with us. After we have shared, please don't send it to us again. Yeah. If you do not send us the PowerPoints, do not send us the screenshots of PowerPoints, because like now, I'm sure some of you can be, instead of asking, you can just be doing the screenshots as you get them. Registration list without a report, you only gives you half of it. We don't require posters unless they are part of the IC materials that you have submitted. But remember again, without the report, they don't make sense. So don't collect so many photos and send, because that is not a requirement. And if there are photos, it should be within the report. It should be part of the report. And again, sometimes you find pictures which have been sent, they are not even correctly labeled. Sometimes they read DCM. You know, the way it was taken from the camera is the way it is sent. And you know, the picture says nothing. Submission of assigned minutes. Please send minutes which have been signed. Non-responsive to remind us on submission of missing or required evidence. So for example, you have submitted the online report, and then we say you have not submitted attached any evidence. Please attach evidence or send to workplace and NACADA. End of story. You don't hear from that person again. And sometimes the person who has submitted is different. And that is the next thing, having each quarterly report submitted by a different person. And therefore, there is non-response to feedback when we provide. Because if quarter one is submitted by Susan Maua, quarter two is submitted by Diana. Diana does not know what happened in quarter one, because once we review and say, please submit this, or whatever you have submitted, and especially those who like attaching things on RAR, sometimes they don't even open. So we say, please, we cannot open. Or sometimes it has virus that even my own computer rejects it and say, please resubmit your evidence. You don't hear from that person again. So if you do not respond, then the buck stops with you, not us, because for us, we are going to give you evidence that we asked you long before that particular time. So what is the way forward? I can see some people already asking, when is the next online training? So for the MDAs, we have one last training, one last class of training. And I'm not counting the one for next week. So because if you have not submitted for next week, yeah, if you have not submitted for next week, we have a training in Kisumu, 28th to 1st of April. And the last class of training is going to be 25th to 29th of April, and it's going to be in Nakuru. And already some people are sending in their requests so that they book themselves a slot. The challenge, sometimes you find at the last minute, like today, somebody sends and they want an invoice today, and it is very urgent, and please now give us the venue. The reason why we are not able to give you the venue in advance is because that venue is also determined by the number of people, the responsiveness of the institutions. We have one more online training in April. I'm saying one more because we have already done 4. We've done 4, and there are people who, Christine, don't ask about the date. The date is determined by when we have the quorum. Okay, so one more training. So if you haven't trained your committee and you want to do the online, the one which is handled by HQ, you have one more. And again, when you engage, when you fill that training booking form, please let the people inside that training booking form know that they have been registered. Because eventually when we have a quorum, then we write to individuals. That is why we ask for the name, we ask you for the email address, and we ask you for the telephone numbers. We don't need those telephone numbers, other than the fact that if you're going to be in the training, then we are going to create a WhatsApp group to make it easy to reach you. In case of challenges, you have queries and so on, and any other discussions or materials that you'd want to share, that is when we use the WhatsApp. After that, we delete your number. We don't even require it. So that is the only purpose we request for your telephone numbers. I know some people want to give us your the landline. I don't know how you're going to be reached on the landline if you're going to register for the training. So please talk to the people you are going to include there so that you reduce the dropout rate. Sometimes we even have up to 100 people sign up, and then you only have 50. In the end, you only have 50. And most of the time you write nil response, you get nothing, no acknowledgement, nothing. And then 3 weeks down the line, when the training is ending and somebody is asking, we asked for this training and so far we have not got. Yeah. So please ensure that you also mobilize. And it has worked very well for institutions that come together, they work as a team, they review their policy, they finish everything within one sitting. So from HQ, one more training. So if you are interested in that training, fill the training booking form. If not, you only have one more other training, and that is the cluster. We've been doing this from Q1. So if you are late, if you discover in Q4 that you have not been trained, it will not be possible, okay? In-house is not available anymore, yeah? As we speak, we already did in-house Q1 and we did in-house Q2, and a few people who had started the engagement earlier on in the last quarter. Those are the only ones we did in Q3, because in Q3 we are focusing on managers and supervisors training. Okay, so take advantage of what is available. Now for training for managers and supervisors, you can see we just concluded one cluster training last week. We have two more. 11th to 13th, we have a cluster in Nairobi, and we have another one in May in Kisumu. So if you are part of the 46 institutions that haven't, there are some that are scheduled. You know yourselves, we have 3 in-house that is already scheduled in April. So if you are one of the institutions that haven't, please take advantage of the existing one, okay? So that is for the MDAs that are not tertiary institutions. So for tertiary institutions, you can see South Rift, and those who are in the South Rift cohort, you know yourselves, South Rift has scheduled one training that is beginning on April 5th to 21st. Remember that for online, it runs for 5 weeks. For 3 weeks, 6 sessions, 6 live sessions, 3 weeks with synchronous and asynchronous meetings. North Rift has also scheduled another one that is beginning tomorrow to 7th of April. So if you are a part of it, then you know that that is the next scheduled training. And probably after that, they may not be doing another one, because again, the dates is determined by the number of people who sign up and also follow through. As we speak, there are trainings that are ongoing, online trainings in Western and Central regions. And if you haven't, and if your region is not indicated here, consult with the respective regional office, and the regional people from our regional offices are also in this call. So that means that even them, if they're going to schedule a training, it will not be like today and then tomorrow you want another one, okay? And also, if you also want to do, I know there are some institutions that are having conversations, like in Western, I think they are organizing some cluster trainings where a number of institutions come together so that they can have in-person training. So consult the regional office to be able to do that. Again, for student welfare, there is one in-house that has been scheduled by Kibabi University. And then we have an ongoing training by Central Regional Office. So if your region is not listed here, please consult the regional office. We have the Coast Regional Office for the 6 counties that are there. We have a regional office for Nairobi that is taking care of institutions, the bulk of institutions in Nairobi County. We have the South Rift Regional Office that is taking care of Narok, Kajiado, Bomet, Nakuru, Kericho, Laikipia, and Samburu counties. We have the Nyanza Regional Office that is taking care of Kisumu, Nyamira, Kisii, Migori, Homa Bay, and Siaya counties. We have the Western Regional Office taking care of Kakamega, Busia, Bungoma, and Vihiga counties. We have the Central Regional Office taking care of Nyeri, Kiambu, Murang'a, Nyandarua, and Kirinyaga counties. We have the Coast Regional Office, like I said, covering Mombasa, Kilifi, Kwale, Taita Taveta, Tana River, and Lamu counties. North Rift Regional Office covers Uasin Gishu, Nandi, Baringo, West Pokot, Turkana, Elgeyo Marakwet, and Trans Nzoia. Northeastern Regional Office is covering Garissa, Wajir, and Mandera counties. And last but not least, we have the Eastern Regional Office taking care of Embu, Isiolo, Meru, Tharaka Nithi, Kitui, Machakos, Marsabit, and Makueni counties. So if your institution, and that is for tertiary institutions, if your institution lies within the counties that are mentioned and the regional office, please consult with them if you have not already done so. So what are we saying? Comply with the work plans. Don't just write a work plan that you don't intend to implement, because that is what we will be looking at. Please take note of the training dates and apply in good time. I'm saying the reason why those who usually come for training, some people want to know the venue in advance. It's not possible to give you the venue in advance. The first thing you need to do is to fill the training booking form. And once we have a quorum, because that, you know, the procurement process is the same, just like in your own institution. So that is why even the ones who are training next week, yes, I still don't have the venue as we speak. Okay, so don't ask for it right now, but you will get it before the week ends. Just know it is in Kisumu for those who have signed up. So again, even for the regional offices, when they indicate, the dates will be given to people who have signed up or who have filled the training booking forms. But you can't ask for a training today for one that is starting tomorrow, because you will need to do the pre-test, you will need to do the pre-session homework before you can come for the live session. So again, please submit timely online reports so that we reduce the back and forth. You know, if you submit online, there is already a time stamp. So it will show whether you submitted in good time or not, okay? So please ensure that you also do timely submission. Again, submit evidence of activities done. Please put them together, because sometimes you find somebody writes and then, oh, find additional one. Find additional one, then they send minutes, which again is loose and again not labeled. So please label your evidence correctly, put them together and submit. You can consult with us when it comes to the issues of submission and any other queries that you may have. There are two ways. You can use that number, yeah, the landline. We will not give personal. And the reason why we do not give personal is the people who work there, today the person may not be in the office or they are out in the field. But whoever is there, because there is a standard way of response. There's a standard way of response. So it doesn't matter who you are dealing with. So if it is Diana, Diana may be on leave or is not available. So if you are dealing with Diana, then you know, you may find Diana is not there. Okay, so that is why we say, please use the landline. And I can see somebody saying the landline is not picked. Yeah, that may not be necessarily true. Yeah, unless that person even went to the washroom. If it is not picked, the call is not picked, the email is there. Write to workplace@nakada.go.ke. If it is training at nakada.go.ke. All this information is available on the website, and Diana will be taking us through to show you where this on the website is, so that then you can see all the things that you need are found in one place. Whether it is the training booking form, it is available there. It is fillable. You don't need to go and print, then you scan. It is a Word document. Just get to fill it, and once you fill it, then we are going to give you feedback. Okay. All right. So at this point, questions? Somebody is asking the telephone numbers and so on. They are available on the website. Okay. So questions, I will now, IT people, you can now manage the raising of hands so that then we can allow people to talk. Okay, so let me start. Okay. So the first one, it is true, landline, especially last Friday, was not picked at all. The entire morning, had to get someone online. Please, Catherine Francis, just do an email, put your telephone number, and you will be responded to. Actually, there were many calls on Friday. There were many calls on Friday. The person, that line was busy throughout, yeah? And there were only 2 people available attending to it. All right, the mobile number for the South Rift manager is not indicated on the website. Chelanga, I know you are here. Please give on the chat the number that is being used by the office. You know, it's not necessarily the manager's number. So put the number for the regional office, the South is the South Rift regional office. Put it on the chat so that they can pick it. But remember, again, these are available on the website. And this is what I'm saying about even mobile numbers. You see, we do a lot of activities, and that person may not even be available at that point. They could be in training, they could be in another forum, and therefore not able to pick your calls. But when you write an email, you will be able to get that. Okay. So let me start from the beginning. Okay, I'll be addressing that. I'm seeing a lot of good mornings. So I'm trying to get to where the issues are. Okay, I think I will start from the bottom. Okay, when conducting a sensitization via Zoom, where people are not in a central place, it has not been easy to have registration list signed by them. George, I have just been mentioning, it's not a physical list. When you do virtual, it's not a physical list. It's not a physical list. Check with your IT person, you should be able to have registration. Even the number of minutes that somebody has logged in, okay? All right, Joyce is asking, we will work together to achieve the goals. That's very good. Which day can we visit your office? It depends on where you are, but you can walk in anytime. You can walk in anytime, all right? Aha, Arnold is asking where to get the booking form on the website. You're going to get it. Which this sensitization was done before setting the PC targets. There was another one that was done in July. Yeah, there was another one that we did in July. Yes, at the beginning, we actually did one. And even as we were giving reports. Okay, is your research team active? I've tried reaching them all in vain. Yes, the research team is active. And right now they are doing remember we also do the 5-year surveys. So right now they are out in the field for if you know that we do 5-year surveys, the last one was 2017. So right now they are in the field doing the 2022 survey. However, research at nakada.go.ke will be helpful to you. So if you can't find people on the phone, please just do an email, okay? If you tried calling, including when you call my number, yeah? Yes, if you tried calling the 0739, chances that I will not pick are very high. Like now, if you are calling me right now, I will not pick because I am attending to this. So, but if you do an email, please, okay? I can see many complaints on the landline. And somebody is asking, how do we label online evidence? You may probably how to unmute, yeah? I don't know what you mean by label online evidence, because whatever you are attaching, if it is minutes, yeah, quarter to minutes, you label, yeah, quarter to minutes. If it is certificates, because those who do, for example, online, we give you an e-certificate, put them all together and submit. So it is about submitting it correctly. Priscilla is saying, is the evidence sent online and via workplace not repetitive? I was just saying that you attach, but should you forget, then you can send your evidence to workplace at NACADA. Otherwise, if you have already attached them, then that's okay. But sometimes I see somebody has attached, but they still don't trust that it has gone. So then they send again via email. You only need to do it once. Mike is saying, who did not finish training last year? Which way forward? You don't finish training, you don't get a certificate. So if you dropped out, maybe you write to us and pick up from where you dropped out. And I'm sure some of you have been writing to you and say you are sending the same list of people who are non-responsive the last time. Why should we include them again? All right. So there's got to be that level of commitment. Okay. All right. So I can see North Rift is actually indicating that I had reported they are starting tomorrow. They have actually pushed it to 24th. You see, that also gives you an opportunity if you are one of those who was still lagging behind. Okay. MTRH, remember that it will reach a point where in-house will not be possible for you. We have had this discussion from October last year. So please note that time is running out for you. Yeah, but remember, there is in-person trainings that you can also take advantage of. All right, so Jacinta is saying face-to-face could be set in future for Central Region. Please communicate with Central Region, and it is still a possibility if you work closely. Lazarus is requests a training of KEMS and NACADA committee members. Well, I don't know what you're saying, Lazarus Kiai, but remember, it is you to, when it comes to implementation of your work plan, you're the ones who need to be. Where are the forms to be filled? Mercy, in a short while, you'll be trained. Susan who? Can students welfare join the one for managers? No, you can't. Student welfare staff are people who deal with students, yeah? Deal with students, the ones in the dean's office, the counselors, you know, all that is the group of people that fall under students welfare. So for managers and supervisors, that's another one. Mercy, the cost of trainings are found on the website. Shortly, we shall do that for you. Modesta is talking about JOST. Submitted a list to be trained in February, but they haven't, up to date, they haven't been trained. What's the way forward? Yeah, this is a Q3 activities. The regional office is represented here, and they will be able to address that. Christine is asking when the online training date is going to be in April. If you intend to be in that training, tafadhali, fill the booking form now, and then we will let the participants know when the training is happening. So Evans is asking how you change login credentials in case of a new chairperson. Just write to us. Just write to workplace at NACADA and say you want to change, so that then even if you can't find your, if you can't trace your work plan, then you'll be able to do that. But again, it's very important that we work as a committee, not one person doing the work. All right. Somebody, Ketura is saying NACADA has not been communicating with my institution since 2018. Yes, you may want to write to us, because I don't know which institution you are in. Please do so. Yeah. Yes, Modesta, training of peer educators is being done by NACADA, because we are talking about informal referral. So it's not just, if you already have peer educators, then it means their capacity will be built, and it's a 3 days training to be conducted by Counseling and Rehabilitation Department. All right, so Elizabeth is asking what happens when an institution has a standard outline for all its policies. Please note that this is a policy that needs to be implemented. This is unlike those policies that you do and keep. All right, so let us hear about that when you send your policy, and also mention that. Okay, so I think that basically, yes, so if we say this evidence is missing, please take advantage and engage. Don't disappear and wait until the next one. Okay. Okay, so let me see if there's any new thing. Eastern region. Yes, Alex has responded to somebody who is all institutions are invited. So please read also what is in the chart. All institutions were invited, many signed up, while others chose to ignore. Okay, so Alex is saying currently they don't have any scheduled online training, and they are focusing on in-house and cluster. So if you are one of those that ignored the call for the training, please liaise with the Eastern Regional Office so that you can agree on the way forward. Okay. So Patrick is asking what needs to be submitted as evidence. If you don't have, Patrick Masila, if you don't have your work plan, then what have you been implementing? So please write to workplace at NACADA if you have any challenges. Lilian Ngeno, we have online training which is free. Online training is free and available and offered by all the 9 regions plus HQ. Okay, so cost cannot be a reason for not training. So do we send the letter of committee every year? No, we do not. And Clara, our trainings actually organized, they are scheduled. They are those that are scheduled. That schedule is there every year. Okay. So, and we stick to the schedule. All right. So can the committee still take advantage of training? The training is for managers and supervisors is very specific. It's just targeting that, supervisors and managers, and it is 3 days. The one for committees is 5 days, Nelly. So please take note that. And of course, for you to do that training, it means you already have your survey and you have your policy and you have trained 3/4. So if your committee has not been trained, they don't fall in this category. Okay. So please take note of that. So I can see you have been given the number that you can reach South Rift. Okay, so Laura is saying we have not yet done training of committee in our institution. Does it affect how we do the survey, sensitization, and also policy making? It will be a challenge in doing the policy. If you've not done the survey, it is also, you are basically going to be stuck because the two are tied together, the survey and the policy. The training of the committee gives you an overview of everything else. And in the training, when you are being trained, whether in person or online, you get to develop the policy. So the training it's two-pronged. You deal with the policy and as you train the committee. All right, so I think that somebody. So this presentation we are going to post on the website so that you can access it there. Okay, so let me see any hands that are raised so that then we can, I can see 9 hands are raised. Oh, they've gone to 10. All right, let me start with Catherine Wimbia. You can allow Catherine Wimbia to talk. Catherine?
Yes.
Yes, go ahead.
Good morning.
Go ahead.
Office. Although this one is personal, where we had trained for a training, where we had paid for a training.
All right. So if it is personal, then deal with it personally like that. Like just walk in this office. If it is HQ, just walk in. We are available for the remaining 5 days of the week. All right. Susan Masharia, go ahead. Susan, unmute and speak.
Oh, is it me? I think my hand is raised just by mistake. I'm sorry.
Oh, okay. Then you can put it down. Let's hear from Georgina Mwaniki. Georgina Mwaniki. Boniface Asigwa.
Sorry, my hand went up by mistake.
Okay, so can everybody put your hands down so that we don't have If you are not ready to talk, please put your hand down so that we only deal with the ones who are truly, yes, lower all hands. So all hands are lowered. So you can raise afresh. Bruno. Correct.
Oh, yes. Thank you, Susan. I want to seek clarification in regards to the baseline survey, student baseline survey. When we were doing staff survey, there were guidelines that were given and it was easy to do the reports. But when it comes to student survey, we don't have the guidelines like we had for staff survey. Is there any way you can assist us so that we are on time and we don't delay on writing the reports? Thank you.
All right. Yes, I'm asking the research person. He actually told me to let him know when questions. So just hold that. You will get an answer. All right. So Dennis Ngashra. Yes, Ngashra, go ahead. Okay. All right. So Dorcas Achieng. Marcela Mumali. Aya, did these people just want to?
Good morning, Susan.
Yes, good morning.
Are you getting me?
Yes.
Hello.
Hello, but
Hello.
Well, we can't hear you.
I have technical hindrances. Can you
Then
hear
use
me?
chat instead.
Can you hear me?
Use the chat. Use the challenges there. All right. Simba.
Is Dennis, can you hear me, Madam Susan?
Can you turn off Marcella? Okay, Dennis, go ahead.
Can you hear me?
Mute Marcella.
Can you hear Madam Susan?
Go ahead.
Thank you so much for the presentation, and thank you so much for identifying the gaps.
Dennis, go ahead.
Are you getting Madam Susan?
Yes, go ahead.
So just want to say thank you so much for the presentation and for highlighting the gaps that have been challenging us quite a lot. Are you getting me?
Go ahead, I can hear you.
Oh, thank you so much. Then I wanted also to appreciate national guidelines for 2021. The topics are so much elaborate and very clear. Thank you so much for bringing it out.
All right. So let's hope you also follow through. You also follow through with that. Okay. All right. Dorcas, is your hand is still up?
Yes.
Go ahead.
Okay, I'm from the Ministry of Water. Hello?
Yes, go ahead.
Yes, so we are having a challenge on mobilizing resources because I think training, I'm the chair of ADA, and I think training is pertinent to implementing all other activities. So what I'm requesting is if NACADA can also lobby for us with the National Treasury that we get a budget line, at least something that we can be using, because it is not easy to convince some of our bosses. We have been pending our request for so long, almost the whole time now for this year, and we have not gotten any allocation to do the training.
Okay.
Yeah.
Okay, so we take note of that, but please begin with the online, which is free.
Okay, right? we have the online, we see the online, but it is not so easy to have these committee members for 3 good weeks. And we also have some technological challenges with the online training, because we are a field-based, technical-based ministry. So you will be having someone, and then all of a sudden these people are in the field, and then there is that breakdown. So we may not have all of them effectively trained.
Okay, so Dorcas, we would want to turn challenges into opportunities.
Yes.
In this particular session, have you seen me drop twice?
Yes.
Yes.
Those are the things I'm telling you.
It is not unique to your institution.
Yeah.
So you could just walk into NACADA so that then we discuss modalities of you moving forward. You see, the 3 weeks does not mean every day.
Yeah.
Every day you are in class. Yeah.
Yeah.
We only have 2 sessions in a week, Tuesdays and Thursdays, and it is 2 hours. All right.
Okay. Okay.
Yes, and that means that even if I am in an in-person training, I will still come. I will still be able to step aside and still attend to you. So there are many benefits to online training. Okay, so just, yes, so if you have challenges, please walk in. This week we are available. We don't have an in-person training, so it means then we can discuss on modalities of you know, helping you move forward before we talk about talking to Treasury.
Okay,
all right.
Thank you.
All right. So any other question? All right, so I have with me from research, Moritz. So that was great. Yes, so any questions, I will move so that then if you have questions on research. So you can ask any questions you have on research. We have the research person here to deal with that. one was the student, the student questionnaire is there, but the report, you know, outline, like in the other one, is not there. So you could just respond to that. That was from Goreti Runo, is usually, I don't remember which institution.
Okay.
Then maybe from the Q&A, someone is asking how could they analyze data even when the response was no. So they have made efforts. 3/4, there's one who said 3/4 of the students have responded, but they have not yet succeeded to get, I think, the number they intended.
All right, so just respond. Okay, so Maurice is here to respond to all questions research.
Okay, so good morning, team. So I think I'm going to respond to some of the areas around research, and especially when it comes to students. I think responding to Goreti is that we have already provided a questionnaire that can assist and can support the MDAs in terms of trying to, you know, get responses from staff. And ideally, for this one, we didn't have a guidance as such, because it was very straightforward in terms of, you know, if you look at that questionnaire, I think there are 5 key areas, and which are in themselves objectives. Because the first objective basically was to just understand the availability and accessibility of, you know, drugs and substance abuse. Then the second objective was just, again, to understand the prevalence of various drugs of abuse among our students. Then the third one, I think, was also to maybe just determine some of the risk factors, you know, that are maybe leading students to, you know, issues of drugs. Just trying to just collaborate or, you know, compare some few variables in terms of maybe, do you have students maybe who maybe the higher classes maybe have higher levels than the lower classes? Okay, sorry. And then the other issue, again, we wanted to look at is just basically understand the sources of drugs, you know, within the institutions. Are there students who are selling drugs within our own institutions, maybe in our halls of residence? Maybe are you finding, you know, maybe are there maybe structures within the institution whereby drugs come from? I think it's good to understand the sources, even as you try to address the challenges of drugs. And I think the last one, basically, again, is just to understand maybe are there some strategies that have been put in place in terms of responding maybe DSA within our institutions. So if you look at that questionnaire, basically those are the key headlines, and basically which are objectives, you know, that we need to respond based on those questions that have been provided under that. I think in terms of the guidelines, I think we wanted to make that need for students very, very simple, and therefore that's why, again, we didn't want to complicate all the issues. So basically it's just taking an objective and basically responding to the questions below that. So I think in terms of the other question was around, I think in terms of response rate, I think if you can target, if you meet around 70%, I think that one is good enough to proceed to do that report. So I think 70% of the sampled students, I think it would be enough for us to proceed and do that report. But in terms of any challenges to do with the report writing, I think you can get back to us, maybe those who have unique challenges. But ideally, it should just be handled internally based on the available capacity. But if there are challenges, I think you can get in touch with us at research@nakada.go.ke. Thank you.
Any questions or comments? Diana, any other question? Okay.
So in addition, any other questions? So I think I can give the floor to my colleague again as we wait for more questions to come.
Okay, so thank you, ladies and gentlemen. Remember, we are here to ensure that we are here to support you, to ensure that you are able to achieve this indicator. Remember, our focus is not on punishment, and that is why we are showing you in advance. This is what we will be looking for. Kuna marking scheme. Sasa kuanguka mtihani will be your issue. Now, from from Western region, George is saying a few institutions in Western are considering pulling resources towards in-person trainings in the coming months. And the institutions, we have Matili, TVC, Masinde Muliro University. And please, if you are interested in doing that in the Western region, kindly engage. I'm told you have a WhatsApp platform. Please engage and do that, particularly those who missed out on the ongoing, because you see, once the online session begins, then you cannot join. You will be behind schedule. Okay, so, all right, Jacinta, I'm sure you've already been given an answer with regard to the survey tool, and also 1/3 of the students haven't responded. Yeah, at least 1/3 of the survey, but have not succeeded. The tool, please engage with research at nakada.go.ke so that they can address. Sometimes you have challenges which are just unique to your institution. All right, so those who are asking for presentations, we are going to post it on the website so that you just take it easy. But of course, we can also send it to all the participants. Priscilla is saying, Priscilla Capsintoi is saying she did not receive Q2 response apart from the Google form. Google form is a response. Okay, it's a response. So if you have not attached evidence, because you see all these things come at the same time, and therefore it means that it takes a while to be able to open and look at each of them. Okay, so I'm going to go to the chat again to see if there are any upcoming issues, and then I will hand over to my colleague so that she can take you through the reporting tools, just in case, because those who are asking, oh, where can we get this? Lazarus here is asking Maurice, how long does it take to complete the survey? Please liars, do an email at research@nakada. How long does it take? So you could, Lazarus, because Maurice is still here, he can respond.
Oh, sorry, Lazarus, I think the survey basically, it depends with the route or the approach you have taken, because we are supporting actual institutions to, even with the online link, which is a bit fast when it comes to use of the online link. If we require an online platform, I think we have a link that we can create for each and every institution on request. But when you choose the the physical questionnaires, it takes longer because you need now to enter the data. But when you use the online link, now you save on that on the time used for data entry. So ideally, then it depends on the approach that you take, whether it's physical or the online. But if institutions require the online questionnaire or tool, basically they can do that on request, and we create so that at least it can save on time. Thank you.
Right. So that is answered. Joan Onyonke is asking, when you say in-house, does it mean that we visit your institution? No, we don't visit. We don't visit your institution. In fact, sometimes when you have people trained inside, then they keep walking out to this meeting, to the other, the response rate is usually very low. So link up with us on the unique areas that you would want to do with that. Magdalene, guidelines had indicated that while doing survey for staff below 300, that we consider census. Is 70% okay as explained in case of sampling? This is another research question.
Yeah, for Magdalene Doku, I think 70% is good to go. You can proceed with the analysis. So what we are saying that we can just work with a threshold of 70%. those who attain that threshold, I think they can proceed with the data analysis, because basically it is representative. Thank you.
Right. So, Margaret, you are answered. And remember, I keep emphasizing that if you have any unique ones that you'd want to be addressed, then please get in touch with research. Eastern region Alex is requesting all the institutions who are yet to be trained to consider pulling resources together for in-person training. Get in touch with our office for in-depth discussion on the same. They are located in Embu. All right, so please link up. Don't wait until the last minute, okay? Don't wait until the last minute, because we are not going to be friends. Because I've already given you the marking scheme in advance. So if you don't take advantage of it, then that will be your issue. So Marcella Mumali is saying she has written several emails seeking assistance concerning survey report, but you have never responded. Is your emails working? Okay, so Marcella, which institution are you from? Yeah, so that Maurice can take care of that. If you have written several emails, yeah. So Marcella Mumali, please indicate your email, indicate your institution, so that then we see if you have, where you have been sending. Because even if you send to workplace, we forward to research. Even if it is info, at least info does. Susan is asking, what do you mean by EAP services? Employee assistance program. That's why it's important. You see, when you get to training, all these things are addressed, okay? So EAP services is, when we talk of employee assistance, it is those services that are available if you're having mental health issues, if you're having substance use issues, you're having challenges. It includes counseling, it includes psychiatric services, it includes, yeah, counseling and psychiatric services, and anything else that will be in between. So that is what we mean. It makes more sense when you have an in-depth conversation, but you could also just call us or walk in, so that in any of our offices, whether a regional office or headquarters, you will still be able to answer. Okay. Mary Kuria, you can unmute and speak. You know, I called a number of people and none of them was speaking. So Mary Kuria, you will be unmuted in a short while. It's alphabetically, so if you go down, M. Okay, Mary Kuria. Mary Kuria is up. Yes, okay, so you have been unmuted, so speak now. You have been allowed to talk, Mary Kuria.
Yes, hi, Susan.
Hello.
I wanted to find out on the issue to do with the students' baseline survey. We had wound up with the staff. But when it came to the students and we were given an online form to fill, it's been quite hectic and the response has been quite slow. In your presentation, I heard you mention that we could use the student leaders as a representative sample for the same. Kindly clarify on the same.
Well, I don't think that is what I said. Yeah, what I said with regard to the research person is here and therefore will be able to respond. So Maurice, you could probably respond to Mary about low response rate from students.
Yeah, Mary, good morning. I think
morning.
I've taken your response is that ideally, even in a natural situation, the online method basically has issues to do with the real response rates. Number one, because unless you have a Wi-Fi connectivity within the institution, I think, unless you provide then students with bundles, then you may enter into those challenges. So in your case, I think the best thing to to address the low response rate basically is to integrate with the physical questionnaires, because physical questionnaires you just fill, you just sample, identify, fill, collect, and then you just do the data entry. So ideally, I think if you want to maybe get a better response, I think just go to the website and download that tool, which is there for all that for all institutions to download. I think you can do that. And those who may require maybe the online, and they feel it can work for them better, just write to us, and then we just create for you your own online questionnaire for your institution. So you can explore both types of methods. But ideally, for the physical questionnaires, the response rate is usually better compared to the online questionnaire, because for the online questionnaire, even you cannot tell who has filled and who has not filled. So you may consider to go the physical way. Thank you.
Thank you, Maurice.
Thank you too.
All right. So remember, you can still liaise even on the email. Like I said, right now they are doing the survey, the 5-year survey. It's a national survey covering all counties. So it's just by good luck that he's also around. So in case of any other issues, just do the email, because wherever he is, we'll be able to attend. So Catherine Musioka, the training charges are on the website. So again, please look at that. Okay, so Esther has responded to Joost. So, Duke is asking, kindly send us the surveys for baseline research on students and staff. I don't know if you're asking for questionnaires. They are available on the website. And shortly, Diana will be taking us through there so that you can have a look. Okay. How much does NACADA charge for conducting the survey if engaged? Magutu and Choka. This is for you, Maurice.
So, Magutu, I think if you look at the process of engagement, I think, and where we are with your financial year, I think the easiest route is to go, is just to do the internal process, the internal survey. Then if you get stuck, you just get back to, you just get to us, and then we guide you on how to proceed and how to do that report. That'll be faster. As I said, right now, there are very many other ongoing activities, and also even other people who had requested, for us to do their baseline. But ideally, the best approach will be either you do an in-house, just using just the local, the capacity that you have, or you can even engage maybe even a consultant who can understand how to do a report or a research. Again, that's again is agreeable. But when you come to NACADA, I think the rates differ because based on different issues, or it's not like a uniform rate. Some depending on the location, whether you have some regions, the numbers. So I think that's how we are able to charge. But I would maybe the best approach is internal. Then you can do a consultant. Maybe it should be the last resort if you want to, because I know you're heading to the fourth quarter, and I think if you want to achieve that, I think you may consider an internal. Thank you.
Right. So you have been reminded that the last minuters are in trouble. Remember, even training, we've said 2 more only. And for that reason, Samson of Nyanza is also saying, those who are interested in the online workplace training to express interest by filling the training booking form and forward the same to nyanza@nacada.go.ke. So please do so. Do not wait until it is too late. All right. So, all right. So I will now want to give Diana, because we want to finish right on time, so that if you still have any queries, still use the Q&A, and I will be able to respond even as Diana takes us through.
Okay, thank you, Susan, for that. I just want to take us quickly through where we can get the resources that we've been asking for. Most of us have been asking, where are we getting the training booking form? Where are we getting the questionnaires and the rest? So we will be going through our website, that is www.nakada.go.ke. And once you're there, you'll be able to get that, which is our homepage. So once you're on the homepage, you will go to Info Hub, and then the drop down, you go to public sector and click there. Once you click on public sector, you get the screen that has public education and advocacy, and you scroll down. That is where we get most of the items you're asking for. The first bullet is the explanatory notes for PC guidelines 2021-22. Basically, this is what we expect the different MDAs to read the first time you get your performance contracting, because this will guide you in terms of what you're supposed to pick, the indicators, the weights that will guide you even as you fill in the work plan. So we did this at the beginning of the financial year, and next financial year, again, we'll be able to put the explanatory notes. Kindly visit and read the explanatory notes, which will guide you on how you're supposed to fill in which activities, the weights, and what is required. The next bullet, as you can see, is the annual work plan. So that is where you get the online work plan. You're supposed to click it to fill it in. We shall do that shortly. Then the next one is the quarterly report. That again, you fill online, so you click there and you get it. Then the other item is the EAP monitoring tool, which we'll also look at just to see how it looks like. And it's the one that you're being told you fill in to give us details of people you have supported and the kind of support that you have accorded them. Then the next bulleted item is the ADA policy development guidelines, which we always refer people to kindly click, have a look, and let it guide you as you do your policy, because it is the flow and the content that we would wish to see in your policy, so that even as you do that, your policy is addressing the issues in your institution. The policy is able to help those who need help within your institutions. So that is the item we've been referring people to. Then the next one is the guidelines on the baseline, how the baseline report should look like. So it is also there. The next bulleted item is the student questionnaire. For those who are doing the baseline for students, it is there. And just like you have been told by Kamenderi, you can always get in touch with them for them to give you the online one. Then of course, the next one is the employee questionnaire baseline, which we also ask you to use. If you're doing internally as an institution, because you have the capacity to do the survey, please use that questionnaire. If you're asking a consultant to do for you your baseline, you're also required to use this questionnaire to guide the baseline. Then of course, for those who are asking where are the training details, how much is the training, when are the trainings, we usually put the schedule for workplace trainings. And of course, this is also revised every other financial year. So ensure whenever the financial year begins, probably by around August, when the performance contracting has been done, we usually have the schedule, so you can always check and plan on when you'd wish to attend the different trainings. Then of course, we have the guidelines for the online workplace training. For those who would wish to do the online training, there are guidelines there. And we also send these guidelines to people whenever we are engaging them to the online training. Then of course, we have the guidelines for online course training for the student welfare. And again, this one is also sent to those who are participating when the online training is scheduled. Then we also have the training booking form. For those who are asking, where do we get the training booking form? It is here. You just need to download it, fill in the details that are required. Most importantly, ensure that, especially for online training, ensure that you fill in the names, the email address, and phone numbers, because when they'll be engaging the online participants, it will be an individual exercise. So for online, ensure that you do that. Again, for the normal training, the cluster training, we require this so that by the time we are booking the venue or we are done booking the venue, we are able to communicate directly to the participants to guide them on where it will be and what is required of them. So far, those are the things that are there. And we would urge you that always ensure that you check on this. Every financial year at the beginning, check to see what is on our website, and it will help you and guide you. Like you can see last year when we had the webinar, we were able also to post it on our website for those who missed so that they could do it. Of course, even this one will post, but always check, it will guide you. You can always go and refer back just to understand something that you didn't get. Then as you can see, we also have videos on tutorials. This was done last year, like we're going to do again now. So you can always go back and refer. Then as you can see also, the scores were put there. So again, this year, the scores will be there so that once you're scored and the scoring is done, we post it there, you're able to go and get your scores. I remember a number of people were writing to us, and more so when they realized that they were being evaluated. That is the time they were approaching us and asking us where are the scores. We always post our scores. So please ensure when the financial year ends, once the evaluation is done and the rating is through, it shall be posted. And of course, certificates for the results are there. You can always check on yours and print it out, but everything is usually put on our website. So please ensure that every other time you visit the website, like I said, it's www.nakada.go.ke, so that you're able to see what is there and it can guide you. So now we'll go and see the form. So when you click on the quarterly report, annual work plan, this is the form that will come. And just to guide, as you can see where it's written email, kindly, just like Susan had presented, put the email address that you'd wish the copy of this work plan to go to. We have experienced challenges. Sometimes people give us info, sometimes they give us for the CEO, the MD, and it becomes difficult for you to retrieve your work plan. Kindly fill in the email either of the chairperson or the secretary, which will make it easier for you to get a copy of your work plan. Then of course, you'll give the name of your institution, the category in which your institution is, the parent ministry of your institution, then the number of staff. If you're a learning institution, the number of institution, and then contact person. Again, here you can put 2 contact people, that is the chairperson and the secretary. Like someone asked, if in event that maybe someone was a chair and probably was left the workplace or probably was changed, you can always do an email to workplace@nakada and indicate that going forward, the contact person has been changed. We have a contact list that we always update. So once you have any changes of the contact person, kindly just write an email to workplace@nakada.go.ke and inform us. For example, if Susan was the chairperson and she's no longer the chairperson, she has probably moved to another institution or you changed within your institution, then Susan would write to us and tell us that she's no longer the chairperson or contact person and provide for us the new contact person. Then that way we'll be able to update our contact list such that whenever we are communicating, we have the right person we are communicating to. So please take note of that. I remember someone asked about that question. Then of course, telephone number, you can always put yours as the chairperson and the secretary. Again, sometimes we put institution phone number, and when we call your institution, they are sometimes not aware exactly who or which department, or it takes long. And usually the reason we ask for your number is so that sometimes when you put in things on your work plan, it's not so clear. And when we write the email, some people tend to be lost, or it brings a lot of confusion. So when we call, we're able to discuss and guide, and that way it is easier. Even when we write the email, you understand better what we mean. Then of course, the last email, you can now put the official email of your institution, so that in event of anything, we are able also to communicate. So once you're done with that, it will urge you to go to the next. So you will click next, and next is where we have the list of activities for ADA prevention. Again, here is where you fill in the activities that you have discussed. The assumption is that by the time you're filling in this work plan, you should have sat down as a committee, discussed the activities that you're intending to do. And like Susan also said, before you fill it in, it wouldn't hurt if you just write an email to us at workplace@nakada.go.ke and tell us these are the activities we have chosen. Kindly guide or check for us if they're okay, and we'll guide and give feedback. And once they're okay, those are the activities you come in and fill. For example, if your first activity is develop an annual work plan, then you will type there, develop annual work plan. Now, the next session, which is activities number 1, performance indicator. I know this one was challenging to many people, but basically this is what, when Susan took you place, the section where we are saying indicators. If you look at the explanatory notes, the section we are saying indicators, those are the things you just type there. So for example, if the first activity is costed work plan, then your develop a work plan, then your indicator is basically costed annual work plan. If your first activity was undertake baseline, then you pick the indicators, which is letter of engagement, the baseline report, the dissemination report, and the rest. So for each activity, the performance indicator is basically what we'll be looking for as evidence. So kindly take note of that. Now, the next session, which I know also was a bit confusing for people, is when we say activity 1, quarter 1 target, activity 1, quarter 2 target, activity 1, quarter 3 target, and activity 1, quarter 4 target. We basically mean that if an activity is 10% or 20%, then that is the percentage you need to distribute, depending on when you intend to do it. So for example, the annual work plan is only done once. So then it means you will put the 10% at that place. So once you put the 10%, then quarter 2 and quarter 3 and quarter 4, you will have 0, 0, 0, because it is an activity that is just done once in quarter 1. If you have an activity, for example, let's say baseline, which is 15%, and you do not intend to do it in first quarter, then your activity in quarter 1 would read 0, and activity quarter 2 target, quarter 3 and quarter 4 is where you distribute the 15% depending on the weight and when you intend to do what. So you could either have 5, 5, 5, or you could distribute it depending, maybe quarter 2, you'll do the questionnaires, quarter 3, you'll analyze. So now again, remember, you need to sit down as a committee and decide when you want to do which activity, which quarter, so that when you're allocating marks, it is very clear. I know the challenge is most people put marks in quarter 1 and they were not able to do much in quarter 1. So going forward, come next year in quarter 1, if you're not able to do anything, it is okay to put a 0 as activity 1, the quarter 1 target, so that we don't look at your work plan and you are saying you have put activities in quarter 1 and you've not given us evidences. Because now we'll respond and tell you that we have received your online report. However, we do not have evidence based on what you had indicated in your work plan. So as you fill in your work plan, please let it come out clearly which quarters you're doing and pick the weights as they are on the form that has been provided in the explanatory notes. So once you fill it, then you're able to submit it at the end of the session. So once you submit, the copy comes to us, and remember the email that you put at the beginning is where the copy will go to. And if ever you have changes to make, you're allowed and you're able to edit the document. Again, like Susan said, remember there's a timestamp on the when you submit it, it's automated. What will happen is that if you're correcting, it will still maintain the time and date that you sent it initially. So those who send it early and have corrections, please correct when you're asked to correct. Your time and date will still be maintained because it shows. If you submitted before 15th, it will show us. If you submitted after 15th, it will show us. So just edit when possible. Then, so that is it for the work plan. So we look at how the quarterly report looks like. So when you click on the website, this is how the quarterly report form looks like. Again, the email address should be the one you would like to get a copy. The same, you have to put the name of your institution, the category, and then kindly ensure when you're clicking the period of the report. I'm not sure, but I suspect that sometimes when people intended to click Q1, they didn't release the mouse from there. So it keeps on going and you find maybe at the end of it, it's Q1, but someone has clicked Q4. Kindly ensure when you click Q1, you move away from the box so that it doesn't continue clicking and you submit for the wrong quarter. So you always click whichever quarter you're submitting, if it's Q1, Q2, Q3, Q4, and then you give us the contact person, the telephone number, and then it will prompt you to go to the next page. So when you go to the next page, this is where you report on activities for ADA. Again, depending on your activities, if your activity 1 was develop the annual work plan. Now you'll say progress of activity. If you have done it by Q1, then you will say the activity is done. If you have not done it, then you'll give us a brief description of what or how far you have implemented it. Then of course, indicators, you tell us what is available to support what you have done. Again, remember, whatever you put here is what you'll be submitting as evidence. And more so, don't, like you had been told, don't give us internal memos and internal meeting, you know, those internal documents. Those ones are good, you can keep in your file as the committee just to know how far or what you've been doing. But in terms of reporting, you give us what we have asked for. So you indicate what is available to show what the progress you have done. So of course, here you come and rate yourself. Again, let's be true. Rate yourself depending on how you've achieved. If, for example, you had said you're doing 5% and you know for sure you have not achieved the 5%. For example, someone was saying that they have done the baseline questionnaire survey, but they have not completed. Now, don't give yourself all the 5 and you know very well you have not completed. Just give yourself maybe 3 or 4, and then you will tell us, because there's a session where you're supposed to tell us why or the variance of that activity. So you'll be able to give us the variance vis-a-vis. So for example, if the baseline is 5% and you're able to achieve 3 because you have done the questionnaire, but you're still analyzing the data and it's not complete, then when you come to the comment section on variances, that is where you will tell us that you are able to do the questionnaire, you are able to gather the report, and now you're doing analysis. However, ensure that by the end of 4th quarter, we have the complete baseline survey. I know most people will tell us we had put, for example, training in maybe Q2, baseline in Q2, but because of financial challenges, we're not able to do that. Please indicate there your challenges. However, ensure that by Q4, your committee has been trained and you give us the report and you have completed whatever reports are pending. Because of course, we understand people might have that challenge, but you need to indicate it here so that as we read your quarterly reports, we are able to pick out the challenges you're facing and we look out for that activity at the end of the financial year. So I hope that has clarified the reporting. So you do the same for all the activities that you have done. I remember there's a time someone was asking, this was on phone, that why are we saying you have to write the activities as you have indicated in your work plan and not go directly to the activity for that quarter? Because remember, we are monitoring to see if you're following your work plan. So the way you had outlined your activities in the work plan, please, when you're reporting, do the same. If an activity, for example, is activity number 2, is about maybe sensitization, and we're at Q2, but you have not done it, you had scheduled for Q3. Kindly indicate there that this activity has been scheduled for Q3. But please ensure as you list down your activities, you follow as you had done in your work plan, so that when we are checking, we are able to see if you're following your work plan. When we are checking, we are able to see if you're submitting the right evidences and we give you feedback. So you go all the way until you're done and then you submit. Remember, we are saying that by the time you're filling in your quarterly reports, you should have at least put your evidences together. Someone asked, how do we label our evidence? Like you have been told, please, if you're putting a folder, write the name of the institution. Sometimes people tend to write their name. For example, I write Diana, then I use a Google form, a Google email, Gmail, or I use Yahoo. So it means that when your form comes, we are not able to know which institution unless somebody downloads and now has to go through. And remember, the way it's automated, it's supposed to go direct. So it means if it goes direct, then it might be missed out. So kindly, when you're putting your evidences, write the name of the institution first, and then you can write your name if you so wish. But please ensure that they are well labeled. If you're putting them as one PDF, then ensure they follow nicely, they're well labeled, and the titles are clear. Sometimes you send us registration lists that do not have a title. It's just name and maybe date and that. So we don't know what exactly it is talking about or what it is for. So please ensure by the time you're doing this form, your evidence is put together so that you can attach. Like somebody said that sometimes they are not able to attach a video or evidence. Please try and now go back. Remember when you're told that if there's an issue, you go to Workplace at NACADA and ensure that you attach it in a format that can be opened. Sometimes you send the RARs and they're not able to open. So please ensure that you send it in a format that can be able to open. We access, we check and see what you have. And also just to note, when you're sending your evidences, as you scan, ensure that your scanner is clear, because sometimes the evidence seems blurry. We cannot see. I don't know whether it's intentional or it's the machines, but sometimes the evidences are blurry. So please ensure your evidences are clear, because once you scan, just go through to see that your evidence is clear and is well labeled, and then you send. So up to that point, thank you. Now I want to share again the EAP tool, just for those who are asking what it's about and what it looks like. So this is the Employee Assistance Program monitoring tool that is also available on the website. Like someone was asking, where does it indicate? This is where you're able to indicate the name of the institution, Then the reporting period, again, you click whether it's first quarter, second, third, or fourth. Then the EAP services, whether it's in-house or you health center, for those large institutions that have their own wellness or clinics within the organization, this is what we're talking about. For those who have external service providers, it's also in the next session. So you tick. If it's hybrid, you have both in-house and external, then you tick. If you have any other, you can also specify there and give the details. Then of course, we require that you sensitize. So you will tick if you have sensitized and provide the number of employees. Again, remember during part of the evidence of EAP, this is just one component, the tool itself. So as you say, you have sensitized, ensure that you submit the sensitization report and the registration list. Then there you go, there are types of problems. So you tick the type of problem that was being sorted or was assisted, and identify the method, if it was self-referral, informal referral, or formal referral. Like one of you was asking, does it also include both students and staff? Like you can see there, you can tell us the number of staff who are there. You can tell us the number of students who have been referred, if it's for counseling. If it's for rehabilitation, again, the same, you can tell us the number of staff. If they are students, the number of students. Then again, those who are utilizing the services, how many were able to use your EAP services? You can tell us the number of staff, the number of students. Again, we go ahead and ask the job category. If it's top management, middle management, technical staff, support staff, you tick which is applicable. And then issues addressed during the EAP, we have several listed there. If you have others that are not in that list, feel free to add down there and type whatever it is. Then of course, we'll go to the demographics. You tell us the gender, how many males, how many females were referred or for counseling, for treatment, or whatever EAP services. The age bracket is also included there. In case you have dependents, you can also include there if they were taken for any services or they were part of the services that you provided. The same is there if you have given aftercare, if it's for the staff, if you involve the children, if you involve the spouse. So you just tick and tell us all that information. And of course, if you have any challenges while implementing the EAP, then you're at liberty to list there and tell us the different challenges that you face, so that even as we go through this, we are able to assist to mitigate the challenges. So that is it. And thank you for listening. I will welcome questions. I can see someone is saying size of evidence. I'm not sure what you mean by size, but if you look at most of the evidence we've asked for, they are not so bulky unless it's the policy or baseline. But if it's not attaching on the online report, then kindly send it to workplace@nakada.go.ke. We'll be able to receive it and put it in your folder. Veronica, I hope I'm right when you ask what is the best time to fill in this form. I guess you're referring to the EAP form. Usually you fill it at the end of the quarter, because at the end of the quarter is when you're telling us what you have done with regards to EAP. So that is when you fill in the form at the end of every other quarter. I'm seeing hands raised up.
Okay, so We have a Lazarus Kiai, could call them. Lazarus Kiai, Zamzam, Ahmed, Jane Mareka, Georgina Mwaniki, Juliana Mutuku, Dorcas Achieng, Anna Ayako. Yes, so I don't know which one of you is ready to talk. So we will open so that then we can, those ones who have been called. Okay, so you have been Lazarus, Zamzam, Georgina, Juliana.
Dorcas.
Yes.
Yes, I'm asking if I'm not able to achieve an activity at the prescribed time that I put initially on my work plan, then I achieve it finally on the final quarter. Maybe it was meant for first quarter, but I've achieved it in the fourth quarter. Will I get the marks or not be given any marks for that?
You still get your marks.
Wow.
Yeah. And especially if you are indicating, because you see, for every quarter, what you have not achieved, you indicate why you haven't. All right.
Thank you.
But at the end of the year, then that becomes a different story.
Are we able to review, now that we are talking on the media, are we able to review our work plan now, or we just leave it as it is, but to indicate why we have not achieved from the beginning?
Dorcas, you said you were at Ministry of Water.
Yes, Maji House.
Where?
Maji House, but I'm currently on leave, but I can still come over. I can still come over.
Take a walk this week and come and solve your manenos.
Thank you.
They seem to be increasing as the sensitization goes on. So just walk in so that we can help you.
Thank you.
All right. So, okay, Juliana. Juliana Mutuku. Anna Ayako. Zamzan.
Hello. Good morning.
Yes.
I was asking.
Hey, you are in the store. We can't hear you.
I was asking, we've done a baseline survey. When we are attaching our evidence, are we able to attach a sample and then the report of the baseline survey, the field questionnaire?
Not samples. Please don't send samples. You see, if it is still work in progress, just indicate what you have done. Yeah. Get what you have learned. That's why we are saying at the end of the year, just like Dorcas is saying, there's something we said we would do. Can we then, report it at the end? If it is baseline, it is something which is still ongoing, you will simply indicate, because there's a place for comments. Then you indicate that this is ongoing. You don't need to keep sending, screenshots and samples.
Okay, thank you.
All right. All right, so who else is? Jane Mareka. Georgina Mwaniki, Juliana Mutuku. If you don't have something to say, just put your hand down. And then Lazarus Kiai. Any one of you? Aaron, go ahead. Okay, looks like these hands are just up. Aaron Mungiria, going once. Juliana Mutuku, going once. Georgina Mwaniki, going once. Lazarus Kiai, going once. It means that you don't have anything to say. Okay, Alexander Ikiki, and then Rebecca Keegan. Alexander. Okay, looks like even that one, the hand is up. Oh, so Rebecca Keegan.
Training.
Say
Is it
again.
allowed for is the training you are talked about about the managers and supervisors? Is it allowed for the managers to come, the supervisors of the institution, the TTCs?
No. TTCs, no. TTCs only have a committee, and from committee, you're moving to student welfare staff. Yes.
So the managers are able to come for the training?
Unless they are members of the committee.
Yeah. And also I'd ask, is there any fee to be paid by the institutions?
It depends on what training you're doing. Online is free. Which region are you from?
From North Rift.
Yes, so from North Rift already are scheduled to start another online training. It is free.
We wanted the face-to-face training.
Then now write to North Rift so that then you can begin that conversation. Yes.
Okay, thank you.
All right. Okay, so who else whose hand is up? Javan Mwiti, I can see your hand is up, followed by Joel Yegon. So Javan, it's your turn.
Thank you so much. Thank you so much for the presentation. A quick one. Number one, just out of interest, whatever you want from us in terms of evidence. For example, you have done a training, you have specified exactly what you want. But I was just wondering, because in terms of coming up with standard or whatever, the best approach in terms of the evidence, at what point do you engage the MDA probably to agree this is the kind of, bearing in mind, of course, now we have online trainings and the screenshots are part of it and all that. But my main just the area I want to probably to react to is whatever you are saying is what we need to give you. Maybe as we go to the next contract, the 2022-2023, maybe you can engage us in agreeing in all those indicators, the best approach in terms of having the best evidence. Because you see from your end, that's what you have developed from your end. But I thought if you can also engage us a bit with the dynamics in terms of now having a lot of online trainings and all the rest, maybe we can agree on bare minimum in terms of what evidence is. That's number one. Number two, training of managers and supervisors. You said there is no online training. I don't know, but of course, us being a university, of course, you know, we went full throttle in terms of automating teaching, learning and all that. So maybe can you consider probably having online also for managers and supervisors? Because I heard you said it's like you just do face-to-face. I don't know if it is not so, then you let us know. Number three, dissemination of survey report. What kind of evidence, when I heard you talk about the kind of evidence that you expect from us, you see, when you disseminate like us, we have an automated communication within the university. And for example, for us, if we are to ask us what dissemination is, even sharing that internally, sharing that through the internet connectivity in the university, where members you share and people give feedback and all that. I mean, for us, we may not necessarily have a meeting for it, but in dissemination, let's say for a survey report, can be undertaken the way we do for other policies, for example, within the university, where we disseminate internally through the online communication, the email, the internal email system within the university, and people are able to interact with it and give feedback and all that. So it's also an observation, because I hand in your presentation the kind of evidence that you want. My point though is that we basically have so that it is sufficient and adequate and very relevant to the various MDAs. Thank you so much.
Right, so you're welcome. Now we'll just quickly, you know, already we are talking of bare minimum. Yeah, bare minimum, because remember that this is as standardized. You will realize that now, if you've engaged with NACADA before, we are now doing what is evidence-based. Yeah. So what is it that we are expecting to do, so that even, and that's why we are saying this is the evidence that you need to provide, because it's already indicated. And that is why you find, first of all, the committee is trained, then you move to the next one, then the next one. And whatever you do is also informed by your research. So that is something that is very key. Now, in terms of managers and supervisors, this is not for tertiary institutions. I hope you did not sign for that. Yeah, because we are only target you. If you remember in my presentation, I said it is only 46 institutions who have signed up for managers and supervisors, and it doesn't include tertiary institutions. So your training has to do with the committee, followed by student welfare staff. That is what you are supposed to do. Now, when we come to another level, then we will be talking about what targets students. So that we'll not discuss right now. Now, when it comes to dissemination and why we are saying that email dissemination is not sufficient, there are many times people saying noted with thanks, but they haven't even looked at it. Yeah, you would be a super institution to have people actually engage and you get feedback on that, right? So that is why we are saying, even though when you send it by intra, have a Zoom meeting and just have people interact with that kind of information, because it is only when you raise people's awareness. First of all, this is the situation at our institution. Secondly, this is what we intend to do. Yeah. Thirdly, these are the services that are available for those who are in need of those services. And then even sensitizations for those who may not be having a problem for now, because probably they are not using, because we have 3 levels. We have universal population, who most of them are not using. We have the at-risk population, that is a selective. And then we have the indicated, the ones who have not started using but are not dependent. Then we have now the ones who are dependent, who are in need of treatment. So you see all those, if you do not actually let people hear it, then that becomes a challenge. So that is why we are saying just sending email is not sufficient. In any institution, including mine here, yeah, when I write there noted with thanks, chances are I have not even opened. I'm just confirming I've received. Okay, so that is. But remember, at the point of before you sign your targets, we need to have a conversation. That is why people send a draft, so that then we can look at it. Once we are in agreement, then you can go ahead. Okay, I hope that clarifies. But areas of improvement are noted. Okay, so Titus Klapan.
Hello, Susan. Mine is to Morris. I just finished the survey using the tool that was there before, the 17 cycle tool. I need the link to see the responses.
17 cycle?
No, there was I was part of the institution, the 500 institutions that were chosen to carry out the survey.
Okay.
So I used the same tool again to do the survey because my responses were low.
Well, he is not here. Why don't you just do an email? Yeah, do an email, and then he can, like we said, there also is some field work that is going on. All right.
Thank you.
So, okay, so let me see who else. You're gone, Joel. Either you speak or you put your hand down so that I clear the list of people who want to speak. Okay, so even Lazarus Kiai, you have carried up your hand. We have given you a chance to speak. You are not speaking. So let me just, as we finish, let me just remember this, the conversation doesn't end here. We just want to, you know, this is a conversation that we need to end, to continue, so that if you still have queries that are not addressed here, please use the right channel to do that. And I will address some, starting from, I've taken note so that I will just respond to you. There are some I have responded to on the chat, but there are those I noted your time so that I can finish up the response. So AUC must be Alupe. Alupe is saying they did not receive a response on their work plan. Please, if you did not, and I hope the person who is communicating to us remains the same, please do an email reminder at workplace so that we pick it up from there, so that in case that slipped, then you will get a response. But like I said, automatically, if you continue to implement the wrong one, like for example, you decided you're going to have managers and supervisors and you are a tertiary institution, then you know that is going to be an issue. Okay, so I hope that then addresses your issue. Sophia Bironga is saying, can the research coordinator kindly send us a questionnaire covering the 5 objectives? I hope now, as Diana took you through the website, you can see where the questionnaires can be found. Then options available for treatment, that was asked by somebody, Nerea. You're asking what options are there for treatment. I don't know if you're talking about your own institution. What has your institution put in place? That is why we are asking for your EAP. However, if you're talking of members of the public or something like that, remember we have 1192, which is a 24-hour helpline. Somebody can speak to addiction counselors so that that is taken care of. If it is your institution, then your institution needs to tell us what is available for your staff. Are you under NHIF? Because there are people who under public service are under NHIF. So it means NHIF takes care of everything. If you are in some of institutions like the sagas, some of them have private medical services. Some of them have hospitals or places where people can get the service and so on. So those are options, okay? But if you're asking about rehabilitation facilities, they are also listed on our website, even those ones that are covered by NHIF. On pure educators training versus committees, remember you implement what you have signed up for. So if you signed up for, if you're a tertiary institution, remember said committee, and I know most institutions, even the last financial year, had not done training. So that should be one key thing that you committed to. And then secondly, the student welfare. So when it comes to peer educators, that's another matter. It is only those who have signed up for it. And that is a totally different thing. Most of those who have peer educators are large institutions like KPA, Kenya Railways, that site where they have so many people. I think it must be Pipeline, Kenya Power, and so on. So again, it is what you have committed for. Alexander is asking, when you are assigned people for training and they are non-responsive, and this is Pest Control Products Board, if we have already given you 3 chances to come for training, why should you give you a 4th chance? That's a question that you should be answering yourself. Because if it means that such people are really not interested in the online training. So you need to have an internal conversation, agree on what you want to do moving forward, so that then if they are signing up for training, which we have only 1 in April, if they do not, if we give them a 4th chance, and you see that means, imagine a 4th chance for people to come for online, the message they're sending is they don't want the online training. So Jane, I hope you have been answered with regard to training. Jane of MTRH, we have had back and forth since October. So you will realize the year will end. And that's why I was saying that in-house you are talking about may not become viable as time goes on, because you will not have space. However, we have online training. I just mentioned there is one last one happening in April. People fill a training booking form, and that cuts across all all trainings. You have, don't write a letter, because even when you write a letter to CEO, it comes to us, then we go back to square one. Please fill the training booking form. Indicate which training you want, online, clustered, whichever it is. So indicate that. So again, like I've mentioned, peer educators only applies to those who had put it in their work plan. Okay, so Isaac Tuna, I don't know if you have been trained, because you're asking if you can send your policy for review before implementation. Remember, it forms part of the training. Whether it is online or in person, policy development or review is done. And it is only at that point that then you can review, you can get feedback. Yeah, like those who are in the last training, I already did that over the weekend and sent you feedback, except I think one institution that I'm still working on. So if you are on your own before you are trained and so on, you will be working on something that you find may not be in line. Yeah. But however, if you feel confident it is in line, go right ahead. At the central office, let me read this for you. Those who are here are in the central region. The central region manager, Amos, is saying institutions in central region planning to hold in-house workplace committees training and student welfare training in Q1 to apply and book before this quarter to enable us plan ahead. So you may reach them at the central email, central@nakada.go.ke, or you could call the number which has been put there. But remember, there is no emergency in Q4. Yeah. So those who are planning to have emergencies, you will find that we have given you sufficient time. So if it is a training booking form, do it now, because time is not on your side. Jacob has also indicated those in the Nairobi region, please contact the Nairobi regional office through nairobi@nakada.go.ke. Okay, so that is provided. Please do not wake up in June or May to say that you need a training. Don't say we did not tell you. All right. So again, Magdalene, what is the maximum size of evidences? I think that has been addressed. Remember, it is not about the quantity of evidence you send, but the quality. Okay. I think the others have already been addressed. Elizabeth is asking if it is possible for insurance providers to reveal specific information about clients seeking mental health issues. Why would they? Why would you even ask for that? Yeah. Why would you even ask for specific information? So that is why we've come up with the form. Okay. It's an insurance cover, an evidence or EAP. Alexander Ikiki. We said this even in the in-person training. You know, I have trained you, so I know. EAP. If it is under insurance, what specific, give the specific services available there. Okay, I think George Bishamwata is asking on EAP, sometimes people may not even be willing to share their ADA issues that would require interventions. Remember again, George, you have been in training and we have talked about those indicators. If you look at even the EAP form, you will see the kind of things that we are talking about. It is not where you corner people and say, uko na shida. The answer is deny, deny, deny. So just remember, just reflect back to the training on what we discussed. Okay, so Laura, I think that has been addressed. The issue of quarterly reports. If you have not accomplished, if you put zero does not mean you have failed. That's the thing. Zero does not mean you have failed. And if it is a quarter, you are not going to do something, just write 0. It means we don't expect any evidence from you. If you are not able to achieve, just like I responded to Achieng earlier, indicate this is not achieved and will be done. All right. The issue is if it is at the end of the year. Yes, if it is at the end of the year, the reason why we are having this is so that we reduce, we reduce complaints. We are telling you in advance, this is what we will be looking for. So if you fail to see it, don't, in August, don't start writing, appeals and so on, because you have a lead time of how many months to sort yourself out. Okay. So Kamweru, we do not have a list of recommended consultants or trainers. Okay. We do not have that list. Okay, Muluka, remember if you're saying it's with administration, your policy, it must also be run through staff. Okay. Okay, so Alex of Eastern is appealing to you to make use of the respective regional offices as much as possible. So all these queries and worries will easily and effectively be dealt with there. Thank you, Alex. So please, don't go whining. Yeah, don't go whining. We are clarifying things. Okay. So Nerea, is it possible to book the next week meeting? Please, Nerea. Please, Nerea, the Nyanza regional office is here and they have already indicated. So you have an opportunity to actually redeem yourself. I believe if you work fast, they would be able to accommodate you. Yeah, unless the regional office has a contrary opinion, I think they would want to have just that one training and finish, and that's it. Right. So I think the questions have been answered. If you still have an issue, please write to us at workplace. Write to us. If it is training issues, then you will write at training@NACADA. But the best approach, fill in your training booking form so that you can be reached as quickly as possible. So that brings us to the end, and I would now want to invite our director back so that she can give us our closing remarks. Director, are you there? Okay.
Yes, Susan.
Yes, go ahead.
Sorry, my internet is not so good, so I will not turn on my video. But colleagues, thank you. And thank you to the pair team for the good and wonderful planning and the presentation. Thank you to all the participants for staying in up to now. I loved the questions and the responses given, and even for the ones who were able to unmute and share. I believe the challenges we experienced last time, we shall not experience them this time. And as Susan has said, allow me to reiterate, work with the regional offices. We have 9 regional offices. They should be able to attend to you. That targeting TVETs, TVCs, universities. For the other workplaces with the MDAs, work with the HQ. In case of any queries or clarities, our email addresses are always working. We shall get back to you. The other thing to highlight is, remember, Q4 is around the corner. Hatuna emergency. So please, let's finalize this now so that we do not inconvenience you at the last minute, and you also do not inconvenience us. We want to support each other effectively. Otherwise, let's work together and let's have fun in this process. Asanteni.
Okay, so thank you so much, Director, and thank you everyone for staying. Thank you, regional officers, for also turning up and also being able to respond to the queries that are coming from your region. So now we can leave at our own leisure and pleasure. We shall send the presentation using the emails that we use to invite you, but we will also post it on our website. That is your one-stop shop for everything that you require. So goodbye, everyone. Let's see. Any other comments?